I thought for a really long time about if I was going to make this video or not, obviously. Well, past a few hours anyway. And I thought I should, if for no other reason as a reminder to myself, stop being so stupid. And you know, it wasn't scary that there's a room full of doctors all squazzed together since they called 911 to take me to emergency. And there's, you know, 4 doctors yelling at you. You should be dead. And I thought to myself, what does that have to do with me being dead? I mean, there's tons of fat black women out there with, you know, blood pressure probably greater than 240 over 218 or whatever. It was 241 when I got to the hospital and finally off the gurney, and all the questions were done, and my head could actually stop swimming for a moment. And the most, I guess, shameful thing for me was when they ask you, you know, all the questions and insurance and blah, blah, blah. So who should we contact for emergency? And I thought, why would you want to? I don't want to bother anybody from their day. If I happen to die, you know, just put me in the ice box, and somebody's going on a fishing trip, just toss me overboard and, you know, keep the cycle of food going. Waste all that money putting me, you know, here and there and calling. Who would I call? I don't have anyone to call. Who would I call? You know? And that's pretty sad to choose to openly admit to people. That's just really sad. And the first person I thought of, he's gone, but it's not like I have any sisters that would come running to my aid and say, okay, you know, we'll take her body and bury her even. So anyway, I digress. I went to the dentist finally, thank God. Sue found me a dentist to go to, and she took me, thank God, and you know, he already shot me up and everything. I'm ready to go. $35 are going to take the tooth out. And of course he went in there and I said, I think that there's really 2 in there, but the dentist who made my uppers, you know, it was closed off, so he just didn't bother to worry about it, and it wasn't hurting, so I wasn't bothered to worry about it either, you know. So he says, you're right, there are 2 up there, we'll take those both out today. Who does that? So he comes and he's asking a little girl that they're training down the hall, did you take her blood pressure? And she says, no. He says, go do it right now. I said, okay. And I'm like, yeah, but he shot me up, you know. So she did that, and she's fumbling with the cuff and whatnot. And I'm like, hey, hang on, done this. Adjust it, put the Velcro on. Okay, there you go. 211 over 198. Yeah, okay, come on, let's go. Take it off, come on, let's come on, take it off, let's go. And she's just looking at me like, and I'm like, little girl, come on, I want to get this tooth out, come on. Doc! She's done, come on, let's go. What is it? Oh my! That's kind of high, and I'm like, if you say so. I said, look, Doc, all these ripped out. All these ripped out. My blood pressure wasn't any less then. Just give me the affidavit. I won't sue you if I should die. Like, come on, let's go. I got, you know, things to do. Come on, just pop those out real quick. I'm big, but I don't need a lot of stuff. And come on, let's go. He says, I can't do that. He says, I have to leave you here to go get a doctor's opinion. And thank God I finally found a really good place. Goes by your income. And they do medical on one side, dental on the other side. Thank So two nurses came back, two female doctors came back, and she's like, how do you feel? You got the headaches? And I'm like, no, I wouldn't know what any of that felt like anyway. This is normal to me. However this is normal to me. That's like saying, do you feel white? This lifetime, I don't know. I don't know what that's like. I mean, you're telling me to go outside the box and look in. I can't. I'm in my box now. Come on. No, we don't feel comfortable. Next thing you hear. So I'm looking. I'm thinking, you just wait. He gonna come pop the cotton out of my damn mouth, and instantly this little tiny 5x5 room is flooded with 6 people in those plastic bunny suit things. How do you feel? One shoves that in their mouth. One is shoving something in my ear. The other one's doing the blood pressure cuff thing again. And how do you feel? I'm like, hey, hold on. Because I'm kind of getting scared now. Can we just like pretend like we're on CSI and just one of you do the talking at a time? Look, I'm a fat black chick. That's PHAT. I've been this way. Whatever this is, all my life. Okay? You tell me to go here, I go here, they say go there. Get your pills, get your Tylenol, Tosh. Well, in order to get the Tylenol, I got to see the doctor. When do I get to see the doctor? In 2 months from now. Fat black girl kind of tends to forget about going back till I need my refills. Okay, so I go to get my refills. Oh, we're not going to refill it for you till you see the doctor. Yeah, that's a real good treatment system, huh? And of course, by then, you just forget and life goes on. I feel fine. Let me go. Come on. No, we're taking you to VMC. What? How the hell am I going to get home? Are you kidding me? And who's going to pay for this ambulance? I can't afford to pull the tooth. And you're going to make me get in the ambulance and go. I said, you know what? Wait. Okay, so how about this? How about if I call a cab and I promise to take a cab there? No, we're here. We're going to take you to the hospital. We're going to take you to emergency. I said, you can't do this to me. I can't afford this. Do you know what you're going to cost me? You know what he says? Yeah, but we have a payment plan. What the fuck do I look like making $2,000 payments for an ambulance that I didn't even need? I can walk myself to the VMC thing. I'll get a cab. So I sat there for freaking 5 hours. Okay, finally I'm done. And they got the tape and the things and the suction cups and I'm like, oh Lord. So the doctor comes back in. What's her BP now? Oh, it's 241 over 218. What? And you're feeling fine? I said, well, I don't know what fine is to you, but Tasha feels pretty good right about now. Getting a little cranky because I'm hungry. I haven't eaten since 7 o'clock this morning. It's, what? About 6:30 now. According to my stomach, right? Yeah. Hurry up and do something. So I talked to the doc. I need and you know, this is about the girl problems and Can you fix this? Oh God, it was just so, I felt like I was in the frickin' Twilight Zone. So I'm all done. I walk like a mile to the frickin' pharmacy. I get there, hand her my paperwork. You know what she says? How are you gonna pay for this? I said, you guys got grant money, don't you? Please, this is the poor people's hospital. What do you think? Here, I got 5 on it. There you go. Give me my 3 meds. Let me go. My ibuprofen, Motrin, iron, and a Tylenol. Please. She says, no, you got to go back to where you came from. What? Because I'm looking like this. Bus stop is right there. Yeah. You expect me to go back there to emergency, walk all the way back there? So I go outside. Now, Stanford has got those little push buggy carts. There are none at VMC, okay, just so you know. We've got the Stanford doctors. We do not have their carts. So I said, okay, let me just stop being stubborn, get it all over with. Now, in between all this, I'm just really thinking, I'm just so in a fog again. Like you have the flu and you're walking to the bathroom and you forget how to get to your own bathroom. And So anyway, a patient had to steer me in the right direction because I was just lost. Anyway, so I did my papers. She's okay. Now when you come back, oh no, baby girl. Now you're a nice lady. You talked to me in the emergency thing over there when I was over there on the gurney thing. I'm a jiggadeer. And you're nice to me here. I cannot come back here. I said this is stressful enough being here. Okay, what do you need? Well, I need proof, you know, that you work. I got that. There you go. Yep, whipped out my little folder and everything. And your ID and proof of where I live. What else? Well, do you have? I don't have no car, no insurance, no nothing. Just that's it, right?